So my name is Ireni Barounis. I am a dentist out of suburbs of Boston. I went to Tufts Dental School and I graduated in 2019. And then I went to residency, did an AGD, and then got into private practice a little over a year ago. So I had no implant experience in terms of like placing, and I've only restored 2 implants in my dental career so far. So yeah, but this was my first time placing. Obviously, like, you know, the placement and actually doing it hands-on is what everyone comes for, and that's like what you want. But just like kind of knowing the planning beforehand and like what you know, what goes into the planning, the treatment planning, and just even just kind of the technique and doing it on the models. I think that was all super helpful to know before actually going into the hands-on. You don't go in like blindly. You kind of are like, oh, okay, like, yeah, this rings a bell from lecture, and okay, now this makes total sense. You know, you don't make sense of it completely during lecture, but definitely like once you go to the hands-on part, it all like kind of comes together. I mean, you know, there's certain ones that I still wouldn't do. I'm not just gonna jump in and go, you know, right to the anterior, but I'm definitely gonna you know, go in and sort of similar cases to what we selected today. I would definitely do a case selection in my own office, similar to the implants we placed today. So I definitely am feeling more confident. Yeah, we did 2, and then I actually ended up doing a sinus bump and an implant placement. So that was really cool. Yeah, definitely. So I was able to do actually like 3 different, so I did a premolar on the upper, I did a molar on the lower, and then I ended up doing the sinus bump and a number 2. So all of that was very diverse, and now I can kind of go in each quadrant and feel comfortable. Yeah, the last one that Katie and I had, we each had, you know, had to spend a little more time with it, but it was really cool because, you know, you try to plan something, but then once you go in, it may end up being a little bit different than what you planned, and so it's like nice to know how to like troubleshoot it once you're in there. So I mean, I wasn't familiar with it before, but it's a super straightforward, easy to use, like user-friendly implant system. So I was really happy with it. I honestly would use it in my own practice. So I had a really good experience with it. It was totally worth it, like 100%. I would recommend it to anybody who has placed some implants but still wants a little bit of help, or someone who is totally new to it and has never placed an implant. So like, I think you guys have really covered every aspect of it, and everyone's been like super approachable, super friendly. I didn't hesitate to ask like anybody a question, which isn't always the case. And yeah, it was overall, like I said, a really good experience, and I would recommend it to anybody trying to place implants in their practice.